Hello, esteemed viewers. Welcome to Medicine Focus. Medicine Focus, as always, is a channel that focuses on the different classes of medications that are being used in the management or treatment of different pathological or disease conditions. Once again, Medicine Focus is here with a very important disease condition often known as peptic ulcer disease. Medications that are being used in the management or the treatment of peptic ulcer disease, in which we are going to look at the different classes of anti-ulcer medications or anti-ulcer drugs, their mechanism of action, some examples, and possible side effects. But before we do that, it's very important that we get to know this peptic ulcer disease first. Peptic ulcer, by definition, is a condition in which there is discontinuation in the mucosal lining of the stomach as a result of acid and pepsin in the gastric juice. Peptic ulcer is different from dyspepsia. Why do I include dyspepsia? Is because some people often mistaken this dyspepsia as peptic ulcer disease. So what is dyspepsia here that is being included? Dyspepsia is a persistent or recurrent pain or discomfort centered in the upper abdomen. So it can be possible that what is wrong with someone is dyspepsia, but one may mistaken it to be a peptic ulcer disease. So one cannot know that unless investigation is being carried out, laboratory investigation is being carried out. So peptic ulcer, the two most common forms of this peptic ulcer disease are those associated with Helicobacter pylori infection and the use of NSAIDs. Less common forms of peptic ulcer disease are those associated with excessive secretion of acid, which occurs in rare gastrinoma, referred to as Zellner-Ellison syndrome. So let's quickly look at the two most common forms of this peptic ulcer disease, which are the infection with Helicobacter pylori and the use of NSAIDs. Helicobacter pylori is a gram-negative bacteria which accounts for about 80 to 85% of peptic ulcer in patients, and is being found to cause peptic ulcer through some series of activities, such as inducing or altering the homeostasis of gastrin, which is the main hormone involved in the stimulation of gastric acid secretion. By producing, it is also been found to produce some enzymes which may be involved in causing tissue damage. Additionally, it also causes hyperacidity in duodenal ulcer, which results from induced hypergastrinoma. So let's move to NSAIDs. Whenever there's injury or infection, the immune system responds with inflammation at the site of infection or this injury. And what induces or plays a vital role there in this inflammatory response is a particular substance known as prostaglandin. So as a result of that, the body produces more of prostaglandin when there is injury or infection. And what NSAID does is that they reduce the production of this substance, which is known as prostaglandin, so that there will be no inflammation at the site of infection or injury. That's the mechanism of how NSAIDs work. So, on the other hand, this prostaglandin, this substance in particular we are talking about, plays a vital role in protecting the gastrointestinal mucosal lining, and therefore more prostaglandin production is needed to maintain the integrity of this gastrointestinal mucosal lining. And by NSAIDs reducing or inhibiting its production, the gastrointestinal mucosal lining becomes vulnerable to gastric acid. So you can see the NSAIDs are trying to do their work, but in the course of doing their work, they are also causing damage to this gastrointestinal mucosal lining. And one thing with NSAID is that they all NSAIDs they have the ability to block or inhibit production of cyclooxygenase, and this cyclooxygenase stimulates the production of this prostaglandin we are talking about. Having now known the pathophysiology of these two, let's look at the main thing, which is the medications. Like I said earlier, going to look at the different classes, mechanism of action, examples, and possible side effects. First class, we have the PPIs, proton pump inhibitors. Proton pump inhibitors, they are benzimidazole derivatives that control the secretion of gastric acid by inhibiting hydrogen potassium ATPase, which is the enzyme responsible for the final step in gastric acid secretion from the parietal cell. Basically, proton pump inhibitors are prodrugs that are carried in the bloodstream to the parietal cells in the gastric mucosa. They are weak base and can withstand acidic environment. They diffuse across the secretory membrane of the parietal cell into the extracellular secretory candidiculus, which is the site of action of proton pump. Omeprazole, rabeprazole, lansoprazole, pantoprazole, esomeprazole, some of the examples of medications under this particular class. Absorption of this medication is being delayed. Maximum plasma concentration is reached after 2 to 3 hours of administration, and it is best effective when taken 30 minutes before meal. Possible side effects include diarrhea, abdominal pain, nausea, fatigue, headache, among others. And these side effects get resolved when there is discontinuation of the medication. Another class is the H2 receptor antagonist, histamine 2 receptor antagonist. This class of medications are all natural analogs of histamine. They competitively block or inhibit the histamine receptors in gastric parietal cell, thereby preventing acid secretion, because pepsinogen is being converted into pepsin with the help of acid. So what this medication does here is that it prevents or inhibits the secretion of this acid so that pepsinogen cannot be converted into pepsin in the gastric parietal cell. Examples of medications under this class are this metidine, famotidine, ranitidine, nizatidine are some of the examples of medications under this class. Maximum plasma concentration is reached within 1 to 3 hours after administration, and it is best administered during evening or at night. Why? Because acid is being buffered during daytime by the food we eat. So if it is being administered during the daytime, it may not have a well-desired effect on acid during daytime. Why? Because it is being buffered. Some possible side effects of this medication are diarrhea and headache. Another class is a bismuth chelate. Bismuth chelate are agents that have been included in antacids for decades, but recently fell out of favor because of its neurotoxicity effect. It is a safe form of bismuth that have ulcer healing properties compared to H2 receptor antagonists. Its mechanism of action is not well understood, but it is thought to have cytoprotective properties. Bismuth is toxic to H. pylori, is Helicobacter pylori, and was the first, and it is one of the first agents to be used to eradicate this organism, H. pylori, and reduce the occurrence of ulcer. Tritopotassium dihydrobismutate, which is a combination of tetracycline, metronidazole, and PPIs, is a very good example of this class. It is being used in quadruple therapy in case of triple therapy resistance. Possible side effects include nausea, vomiting, blackened tongue, dark feces. We also have antibiotics that are being used in the management of this disease, particularly to eradicate this H. pylori, either by the action of bacteriostatic or bactericidal. Examples: the clarithromycin, metronidazole, some of the antibiotics that are being used in the management of this disease condition. I also have antacids. Antacids neutralize the effect of gastric acid because antacids provide immediate symptom of relief and a more rapid response. Their duration of action is very limited, hence needs to be taken several times a day, minimum of 3 times a day, usually after a meal or at bedtime. It should not be administered along with other medications because of its neutralization nature. So that's that. If you enjoyed this video, drop a comment and make sure you subscribe to this channel so that you can get more updates, content from Medicine Focus. As always, I remain loyal for Medicine Focus. Have a nice day.